Sorry, I didn't know if I was starting or not. Hello, everybody, and welcome back to the Julie and Crystal Show.
Hi.
How are we doing? So today we are going to talk about a pretty sensitive subject. And I guess I'll just say it's about pregnancy and childbearing. So if this is something that you are very sensitive about or it's a trigger for you, we're just gonna let you know ahead of time that either you might want to grab some tissues, which we have our lovely toilet paper.
This is what she gave me.
Oh yeah, I gave her the small one. She's like all sad about it. I am a guest. Here, you can have a couple squares. So we got our tissues, and you're going to be hearing a lot from Crystal right now. So just to recap a little bit, pulmonary hypertension is high blood pressure in your lung vasculature, not the rest of your body. So that makes it hard for the heart to pump blood from your heart to your lungs to get oxygenated, to feed oxygen to the rest of your body. So what that means is we're short of breath, chest pain,
Lightheaded.
syncope, which means passing out, lightheaded, tired, all kinds of things. It's different for everybody. But one of the big things with all of our medications is we have to be on 2 forms of birth control. And I do believe that if you have an IUD, you can just have one. Or if you go and get a tubal ligation or get everything just ripped out, then you're good. But this is something that when Crystal goes to her doctor, he gets on her about water consumption. He gets on me about birth control. So, because I'm not the most compliant with my birth control. So, yeah, we're working on it, okay? So anyway, it's very important. We have to get pregnancy tests every month. When we reorder our medications, they ask us if we've had our monthly pregnancy tests and if it's negative. So we are not really supposed to get pregnant because it's too much demand on our bodies and our systems, and it can lead to death of the mother, death of the child,
Or both.
both. Premature delivery, which then has its own problems. And then, yeah, Crystal's gonna tell us a lot about her adventure, not really an adventure.
Oh, it was an adventure.
Her time with pregnancy. But just briefly before that, I was diagnosed when I was about 20. So I was, at this time, in my undergraduate studies, kids were not on my radar. This was not something that has been a passion of mine for, most of my life. So I was like, cool, whatever. I can't have kids. And they're like, wait, hold on. You can get pregnant. You just shouldn't. And then I'm like, okay, there is a difference.
Yeah.
Big difference. So then after I graduated with my master's, I moved to Mansfield to start my job. And then when life kind of settled down, I was like, I kind of want kids. And then just the thought of not being able to have kids, it was very sensitive for me. And I would have to explain to my new boyfriend's mother, like, you're not going to have grandchildren from us.
Yeah.
She has grandchildren. She just won't get them from us unless we decide to adopt, which the adoption's great. I love it. It's just not in our plans. So now I'm back because I kind of did this little roller coaster ride. Now I'm back to, I'm 33, getting older. I'm very accustomed to coming home and watching TV. I love my free time. And I have plenty of nieces, nephews that I get to spend time with, and I kind of get my fix with that. So I'm kind of okay without kids right now. But Crystal, on the other hand, this is something I'll just kind of I'll try to segue it in.
Yeah.
This has been, having kids is something that she has always wanted ever since she was probably, 3 or 4?
Little girl, yeah.
Before you know that age when you start realizing, oh, this is what I want to do, or, I want to be a mommy playing dolls. That was Crystal.
That was me.
And she has been told countless times that she cannot have kids. So Crystal, being the stubborn, driven, hard-headed person she is, said, I'm going to prove you wrong.
Watch me.
So go ahead.
All right, so, excuse me. Yeah, so as Julie said, I was that little girl who, when somebody asked me what I wanted to be when I grew up, I said I wanted to be a mommy and a heart surgeon, but mainly a mommy. And that's what I am. I'm not a heart surgeon. I wish I was. Anyway, I was put on birth control when I was 14, just because that's when, you know, people start having sex apparently and all that kind of stuff. So they like really pounded in my mom and me that, you know, if I ever got pregnant, I would most certainly die with this disease. You know, it just can't be done. Like, just don't do it is basically what I was told all the time. Well, as I got older and I got, you know, serious boyfriends and such, I would ask, like, what if I got pregnant and I came to you? Like, what would you do then? And they would just say, please don't do that. Just don't let it happen. You cannot do that. I even had a couple of doctors say that they would not take me on as a patient if that was in my plans. Just because it is a huge high-risk thing, and they just don't want that on them, which as a PA, I'm sure you know,
yeah,
that's a severe thing. So anyways, my husband and I was married prior to my current husband, and he didn't really want kids like that much, so he was kind of fine with not having our own kids, and then it kind of came to a point where we were married for a little while, and we kind of decided we did want kids, so instead we decided to foster to adopt. And that's a completely different story as to what happened, but needless to say, we got divorced and we did not adopt those kids that we had.
Know you've done foster twice now.
Mm-hmm. Yeah.
Awesome.
And so that was kind of my thing. I kind of started to become okay with, I'm never going to be able to bear my own children, so I will foster kids that need homes, and I will adopt kids because I know there are so many out there that need homes. And I am still a huge advocate for foster care and adoption, even though I now have my own. But so that's what we did, and I'll tell a little bit of the story actually, just because it kind of goes into the whole story. He and I had 2 foster kids. One was 4 months when we got her, and her brother was 22 months when we got him. And we were really close to the adoption being final, like within a couple of weeks, and I found out that he had had an affair and actually got the girl pregnant. So that was like the worst possible thing that could ever happen.
I can only imagine.
Because number one, we ended up losing the kids over it, and he got somebody else pregnant. Like, my dream was given to somebody else by my own husband.
Now, were you guys caught taking precautions, or? Yeah,
I was on the depot shot. I was on the depot for a year. So, like, when I was 14, they put me on the depot at that point, and I was on that forever. So anyways, he basically took away the only chance I ever had of being a mom, which I absolutely hated him for. We're actually friends kind of on Facebook now, and I'm cool with it, whatever, because he has a miserable life, and mine is absolutely amazing. It's amazing how karma does that. But anyways,
yep.
So it took a long time for me to forgive him for that, and then, you know, some years went by, and I am, you know, now married to my current husband. Sorry. And I told him, we went to high school together, so he kind of knew a little bit about my condition, and, you know, I shared with him, you know, because of my heart and lung condition, I'm not going to be able to give you kids. And he's like, that's fine. And I'm like, no, you don't understand. Like, one day you're going to want kids, and I cannot give you kids. And he's like, no, it's fine. I love you. Like, I don't care. And it came to a point where I was, like, so upset about it that it bothered me. Like you said, you had to explain to your boyfriend's moms, like, I'm never going to be able to give you grandkids.
I don't even know if I have face-to-face explained that to her.
Really?
I think he may have.
Yeah.
Just because at that point it was kind of sensitive. Like, you know, the phrase was getting thrown around.
Yeah.
Oh, well, when are you guys gonna...
Yeah.
Like, or when it happens with you guys. And I'm like...
not going to happen.
She doesn't know.
Oh, God. Yeah, so that's really hard. And that was the hardest part for me, because at the time, my husband's brother didn't have any kids either, and he wasn't settled down and married or anything. And so we were married, and it was like, okay, so the next step is you get married, and then
everybody
you have kids.
Expecting
that's
kids
just what you do, apparently.
Yeah.
And so I had to make sure that she knew that, because I felt like she would never be able to be okay with it. And to be honest, she really was... This sounds horrible because she is an amazing person. She was honestly not okay with him necessarily being married to me because she was so worried that if something happened and I died, her son would just crumble. Mm-hmm. Which I can understand as a mom. You know, she was just very worried that, you know, if I passed away, like, his life would be over, basically.
But don't you kind of feel like that getting into any relationship, you worry, do you ever worry about, or would you hold yourself, I know your answer and I know my answer, but I feel like some people would hold themselves back from a relationship in love because of that fear of leaving them at some point.
Oh my gosh, I've had that.
Crumbled.
Yeah, for sure. But I'm saying, like, his mom's best friend was a nurse, and I'm sure that she told her about me, and she actually was my neighbor. It was so weird how it all happened. But she had told her about me and kind of told her about my condition. So I think she kind of had it in her head what she knew about it to be true, which it was true, but I think she just kind of had that outside view of, if this girl dies, which is more likely than just a normal girl, what's going to happen to my son? So right. I get it. But so in telling her that I wouldn't be able to give her grandkids, like, that was awful. And I remember getting to a point in our relationship where I actually questioned, like, breaking up with him because I couldn't be the one responsible for him not being able to be happy and have a fulfilled life if ever he wanted kids. Like, it was okay then because it was new and we were in love and all that. Yeah. But when it came down to it, one day you're going to want kids, and I don't want to be the one responsible for not being able to give that to you. Right. So when it came to that, we finally, I was working at Cleveland Clinic, and my pulmonologist there had several talks with me, and he's like, you know, you're in this serious relationship now. What are you doing for birth control? And I was still on, you know, Depo I was on it for 10 years total. And I was like, you know, I'm still in Depo. And he's like, you know, we've had this talk before. If you get pregnant, he's like, I think I would have to dismiss you from my practice because, number one, I don't want to see anything happen to you. And number two, I know how you are and how stubborn you are. And I feel like you're going to be that person that's going to try to push the limits. Yeah. And I did. But, so, I don't even really, I know what it was. I ended up having some female problems, and I went to the emergency room in Shelby, and I didn't have an OBGYN, and so they referred me to a physician in Shelby, and when I got there, he, you know, started asking me about birth control, and I said, you know, I'm on Depo, but I don't want to be on it anymore, I want to quit, and I was like... I have
a question about that. I'm sorry, yeah. I'm going to kind of interject here.
Go ahead.
Interview my interviewing skills.
Do it.
I thought we shouldn't be on hormones.
Right. For that. So you can't be on
traditional birth control.
Traditional birth control. Like, you can't take traditional birth control pills. It has to be just progesterone only, because the others can cause blood clots.
Yeah. So and from what I understand, we have a hypercoagulability state with being having pulmonary hypertension.
Yes. Okay. So basically, just to back up, just to pause really quick. So because of the pulmonary hypertension, our body is constantly trying to make more red blood cells to carry oxygen. It's kind of like tricked. It almost doesn't know what it's supposed to be doing. So it's constantly trying to make more red blood cells. So it makes our blood like really viscous, like thick. So we're very prone to blood clots, which is why we can't be on traditional birth control, because birth control, that's already one of the side effects, is you possibly could have blood clots from it. So for us, pulmonary hypertension patients, we definitely cannot be on traditional. It has to be progesterone only, which is what Depo is. So I told him I didn't want to be on any birth control, and I was like, you know what, I don't even know if I can get pregnant. And he's like, I was on Depo so long, I don't even know if I can get pregnant. So he's like, well, I'm going to refer you to a fertility specialist, and you guys can go through the testing and go there. That way we don't have to put you on something if you don't need it. And I was like, okay, cool. So we went to this doctor at OSU, and we did the testing, and he did ultrasound and blood work and all kinds of different things. And he's like, well, the good news and the bad news are the same. And I was like, what is that? And he's like, you definitely can get pregnant. And I'm like, oh, well, I get it. It's good news for me, but it's also bad news for me. So he said, you know, Mrs. Harris, you need to, we were married by this time, you really need to get on some type of birth control. He's like, if it's not Depo, he's like, we'll find something else. You've got to be using 2 forms of birth control. And he said, you know, the chances of you surviving a pregnancy is 50%. And he's like, those are odds that you shouldn't be comfortable taking. And I was crying, of course, because I had been told this by so many doctors that I was just sick of hearing it. Even though I knew what he was going to say, I just needed to hear it again. And I kind of felt...
It doesn't hurt to ask.
I know. I kind of felt like if I heard it one more time, then I'd finally be okay. Like, I just had to ask everybody, I guess.
But there was, like, always that one more time.
Yeah.
One more time.
Always one more time. And so I remember standing up and I was like, well, I guess I'm done. And he said, hold on. And I looked at him and I was like, you know what? You're not God. You don't know that I'm going to die. And he's like, hold on, just sit down. And he's like, I know a fertility or a high-risk specialist at Ohio State, and I'm going to refer you to him. He's like, I can see that this is something that you want so bad. He's like, talk to him and see what he says and see if there's anything they can help you do. And I was like, okay, cool. So I got into Dr. Colombo at Ohio State, and I walked in, and it was just the craziest thing because he had my chart laid out on his desk, and Bryce and I walked in, and the first thing he said to me, he's like, you want to have a baby, huh? And I was like, yep. And he's like, is this baby's dad? And I was like, yeah. Like, who else would he be?
So.
My brother? I don't know.
Yeah, you know.
And I said, yeah, it's my husband. And he's like, okay. And he says, I think we can help you. And I was like,
for the first time,
I was very confused because I was like, do you have the right chart on your desk? Like, I really thought it was somebody else's chart because he was the first person and he was so nonchalant. He's like, I think we can help you. It wasn't like, this is really risky. Like, that's just what he said. And I'm like, hold on, back up, and he explained things. He said, this is risky. And he said, I do agree with, the other doctors. However, I work with a team and we have done this before. And I think that if we do this the right way, that we can make this work for you. And I was in shock. I could not believe it. And we went outside and had sex. No, I'm just kidding. That's not how it happened. So we were happy. Yeah.
Supply room.
We were
like in Grey's Anatomy.
Oh, yeah. That wasn't like we didn't work there, though.
Yeah, you could bust into one.
Yeah. So so we left on the high because that was the first time that we ever actually held on to a dream of like, oh my gosh, this could actually happen. And they set us up with Dr. Daniels, which is my current doctor now, my cardiologist and pulmonologist. And we went in to his office. And he basically kind of said the same thing. It was the very first time I met him. He came in and he said, so, here you want to have a baby? And I was like, mm-hmm. And I had a cardiologist and a pulmonologist at Cleveland Clinic at the time that I was going to see him. So I kind of did it in secret, I guess. And when I was there, I thought he was just going to basically tell me the same thing. Like, yeah, he made a mistake. It wasn't, we really didn't look deep enough into this. He literally, I was in their office for 8 hours.
Oh my gosh.
A whole work day for them, just so they could give me an answer. So he ran every test possible. He spent hours, his nurses, whoever, spent hours trying to get my records from the other hospitals that I'd been in just to get my history. And they did CT. I mean, they did everything you could even think of. And by the time I left there, I left with, Crystal, I know this is what you want, and if this is what you truly, truly want after you guys discuss this, I think we will be able to help you. We've done this before. We meet every month with Dr. Colombo, which was the doctor who sent me to him, and we sit around at a big table and we discuss our cases of our women who are pregnant. And at that point, it made me realize, like, oh my gosh, this is real. This is really happening, and they know what they're doing. Like, this is a legit thing. And he told me the number of pregnancies, and I didn't remember what it was. Probably, I don't know, was it 50 or 100? Like, they had done it several times, so it wasn't like I was the third patient and I might be okay. Like, they had done this so many times that they had a rhythm. They had, medications in place. They knew what to do to make these pregnancies successful. And the one thing I will say about Dr. Daniels is he is also a pediatric cardiologist and pulmonologist. So he works with the babies. So he works with
adult and adolescents.
so he works with the kids who have congenital heart disease who actually grow into be adults, because it's not normal really in our society that there are many adults living with congenital heart disease, especially ones that have not had any repairs, which I have not. I've not had any heart surgeries, no lung surgeries. So we're very rare. And so for him to be seeing adults now with congenital heart disease is like not very common. So I'm trying to think where to go from there. So anyways.
So how long did it take before you got pregnant?
So I was pregnant probably the day I was sitting in his office and didn't know.
Oh, yeah, that's right. I remember you saying that.
They actually called to where because like Julie said, we have to take pregnancy tests every month for our medications. And I was probably pregnant, just barely pregnant, because I didn't even like, pregnant? Yeah, like kind of pregnant, like a couple of, like a week maybe, I don't even know. Because they had to do a pregnancy test and make sure it was negative before they did the one scan. Yeah. And I probably was pregnant but didn't know. And it was so funny because when I finally did go back and they're like, did you even wait until you got out of the office? Like, it was like we really did just go do it. So unfortunately, so we got pregnant right away and I ended up having a miscarriage. And at that point I was really, really, brokenhearted, almost more so than I was when I was told no a million times, only because I felt like this was something that I was told no, 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 no. And then I was finally given a yes, and then it was ripped from me. And so I was like...
You felt defeated.
Yeah, I was like, why would you tease me like this? Like, I was mad at God. I'm like, why in the world? You know how bad I want this. Why would you give me this baby and then take it? Like, is this a joke? Like, I'd already had 2 foster kids, or almost adopted kids, ripped from my arms. And now you're telling me I can get pregnant, but now you're taking this from me too. So that was really hard. And then it got harder because I had 3 other miscarriages after that. And Dr. Colombo told me that it wasn't because of my condition. Like, they couldn't nail down a reason why, but he didn't think that it was due to my condition. You know, and he kind of let me know how many women actually have miscarriages every single day. Some people don't even know that they've miscarried because they didn't even know they were pregnant. So he just made me feel better in knowing that it happens to everybody. It didn't just happen to me because of the pulmonary hypertension and my heart disease.
Were you still working at this time?
Yes.
As an LPN in the area, right?
Yep. So I had 4 miscarriages, and, you know, I think men deal with that loss different than women do, just because they don't feel it. They don't realize it's not really happening to their body. Right. And so
you're probably how
and I was so
far
early.
along were you?
So the furthest I ever got was 9 weeks. I had 1 at 4, 1 at 7, 1 at 9, and 1 at 6.
So I would imagine, you know, the guy, you know, Bryce wasn't seeing the pregnancy changes, and so it'd be a little harder to attach himself to that.
Yeah, to be real.
So it makes sense.
So anyway, then we got the very last miscarriage, and I will tell you guys, I think I've mentioned it in other videos. I'm a Christian. I believe in God. I believe in Jesus. I believe, like, my faith is like huge, because I feel like without God, I definitely would not be here right now. I know not everybody believes in, you know, in that, and I'm not trying to like make people believe in it, but that's just what I believe in. And so it got to the point after our 4th miscarriage. I remember we were going somewhere. We were both in good moods. We had just had the miscarriage, and we put in a McDonald's, and Bryce had to go to the bathroom or something, and he went in, and when he came out, there was this lady getting into a van, and she had like 6 kids. And he got in, and he was just in this really bad mood, and he was like almost in tears. I'm like, what is wrong? And he's like, I just don't get it. He's like, people have 6 kids and 4 kids and all these kids. He's like, we just want 1. Is that too much to ask? Mm-hmm. And I was just like, oh, now you know how I felt my entire life. Like, I've always felt like that. Like, I just want 1 kid. Just please give me 1. Stop.
I think the hardest for me is when I see shitty, excuse my French, shitty situations, parents, and I know I can provide a child with a way better life than what they are dealt, or they're in foster care, they're in the system, that's what's harder for me. Or if I even just see people taking advantage of taking their parenthood for granted.
Yep.
And I know that's my own issue. I should not be mad at them for that, but that's when I get mad.
It feels. Yeah.
And I'm like, I shouldn't even have kids, and they're just, ditching time with their kids for other stupid things in life.
The hardest part for me, and again, I don't want to do this doesn't have to do with political or anything like that, but I do have to bring it up. I was working in the emergency room. I was an emergency room nurse, and I'll never forget, I had just had a miscarriage like the week before, I think it was, and I had gone back to work. And one of my patients was in there because she had had an abortion and she was having problems after. And she was in this room and she was with her friends and they were laughing and joking and just having a good old time. And I was her nurse and I had to go in there and do what we do, is care for our patients no matter what. Mm-hmm. And I couldn't do it. I broke down. I went to the desk and I was like, so-and-so, will you please take over a room, blah, 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 for me? I cannot do it. And I explained why, and she was so gracious and took over for me. But stuff like that, like you see, like you said, women who aren't caring for their babies, or they think that it's a big joke if they've, had an abortion or whatever. Like, there's people like us out there that want a kid so bad, and there are people taking advantage of their reproductive health. They're taking advantage of the system with their 12 kids. Like, it's just a really touchy subject for a lot of people, especially when you know that you could give a child home, love, attention, and people are out there just taking advantage. So that was a big thing for me, and I did battle that for a really long time. So that's all I'll say about that. But
I think I'm just kind of realizing that me being angry about it is kind of my own problem. Yeah. And it's not their fault. Right. So I just need to get over myself and just move on with life and not pay attention to. It's like comparing yourself to other people. Yeah. You just can't do it.
Yeah, but I mean, I remember times like, all my friends were having babies and they were inviting me to their baby showers, and that was like awful for me to go sit through a baby shower, or to, not to be happy for their pregnancy, but just to sit and wonder, be like, I wonder what it feels like to be pregnant. Or, oh, she has a cute little baby bump. I wanted it. Yeah. So I mean, it's these normal feelings, and I don't think our disease is the only one that faces that. I mean, there are women all over the place that can't get pregnant because of infertility issues, or some other reason. Like, you're just longing for something you can't have, and it makes you want it that much more. So anyway, Bryce and I kind of talked, and we're like, you know what? Maybe this is God's way of saying, you know what, Crystal, all those other doctors were right. And if you get pregnant and you get past a certain point, you're going to die. And I don't want to take you out that way. That's kind of what we settled on.
Did you guys have the conversation of, because this is kind of what Chad and I would discuss. Like, he doesn't really want, I don't know. He said he could take it or leave it.
Take it or leave it.
He's not gung-ho for kids, and
doesn't hate them. He doesn't love them and doesn't hate them.
He might be a little more on the spectrum of, I don't want kids.
Yeah.
But if it were to happen, I don't think he would be mad about it.
Right.
But we've had the conversation. I'm like, well, if it happens, I want to try to carry it and try to go through with it. Yeah. And then I know he worries. He wants me around.
Right.
And putting my life at risk.
Yep.
And in my head, I think, why would I be so selfish to want to have this kid when I know that I could be leaving my husband, my boyfriend, whoever, with this kid that he didn't entirely want.
Right. Yeah.
So that's kind of like what goes on in my head.
So it was too. Bryce said the same thing. Like, I would rather not have a baby than to not have you. And that was just, and like I said, it wasn't any guilt or any feelings that he had that he was putting on me. It was my own guilt and my own feelings and my own desire. Because my friends told me, they're like, Crystal, that's really selfish. Like, if you die, you're going to leave Bryce. But if you have the baby successfully and you die, you're leaving Bryce with a baby. Like, And they did. They called me selfish. They thought I was selfish. And they had a point. Like, I wasn't mad at them for saying it because I knew, I just knew how bad I wanted to be a mom, and I was willing to do whatever. And I think I talked in another video about how stubborn I was and how I always wanted to prove all the doctors wrong. Like, I was supposed to live to be 10. I fought to be 11. Like, I've always fought to get to that next level where everybody says you're not going to go.
Yeah.
And I knew my body. And like I said, I've lived with this my entire life. I know my limits. And I was like, you know what? I can do this. Like, I'm going to prove them wrong. It wasn't even at that point of proving them wrong. It was the fact of, like, there was something in me that was like, I know I can do this. Yeah. I know I can do this.
That's kind of how I feel. Like, if I were to get pregnant now, I just feel like there is something inside me that would do it. That I can do it.
And I just want to say, too, please, 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 please do not, whatever you do, think that hearing my story is me giving you permission to go get pregnant. I don't ever want anybody to think that, like, we're thinking, like, oh, well, she did it, I can do it too. Like, yeah. I know my body. I've lived with this my entire life. I know my limits. My doctor is one of the best in probably the nation or the world even.
Yeah.
I know, actually, there's been a patient that came from, I believe, China.
Oh, really?
That was pregnant and came to him. So,
wow.
I mean, people seek him because he is the number one doctor, I think, who's done a lot of this. So
let's get to you are pregnant with Camden.
Oh gosh, okay. So Bryce and I decided, you know what, we're not in charge of life and death. If this is how God wants it, then that's how God wants it. We stopped trying. We just kind of let things go, and lo and behold, we're pregnant. So as soon as
always happen that way, right?
I know. So as soon as we got pregnant, I of course called Dr. Daniels and I'm like, hey, I'm pregnant again. And they're like, okay, you know, these are the things you're going to do. So I had stopped my Triclear. That's one of those X meds that you can't be on with pregnancy. So I had stopped that when they said that we could start trying. So that had been off the table for a really long time. I wasn't on any birth control, and we were just kind of doing what we were doing before, just not making it a point to try to get pregnant. So I ended up pregnant. I called them, and, you know, I started having ultrasounds and stuff. And I remember my very first ultrasound, where they were going to check for the heartbeat. I wouldn't let myself get excited because I was like, you know what? I've already lost 4. I'm not supposed to have a baby anyway. So why would this be any different? And when I heard that baby's heartbeat, I couldn't cry. I couldn't do anything because I couldn't let myself think it's real. Because if it was real, then it could be taken.
Yeah.
And so, and that was how it was my entire pregnancy. I did not get excited. In my head and in my heart was like, I cannot love this baby because as soon as I love it, I'm going to have a miscarriage. I didn't go buy anything. Like, I just could not attach myself to this baby. And it wasn't because I didn't want to. I fought it.
It was your defense mechanism.
Yeah. I could not face the fact that I was going to lose another baby. So I just didn't love it. Like, I was just like, nope, I'm not going to let myself get attached because as soon as I do, something bad's going to happen. It always does. So anyways, they watched me for every week. I had an ultrasound every single week just to make sure he was still developing, still growing. Everything was still going well. And every single ultrasound, same thing. I could not let myself love him. I would get excited, be like, oh my gosh, he's so cute. Oh, there's his wiener. It's a boy. Like that kind of stuff. But I could not let my heart attach to this little baby inside me. I just couldn't.
Yeah.
So what happened was Dr. Colombo, my OB at Ohio State, said, there's no way that you're going to go full term with this baby. I can tell you that right now. And so the plan is when you get pregnant, they start you on the Remodulin, because that is what makes the postpartum period basically safe for us, if there is such a thing as making it safe. So they're like, we're going to admit you at 25 weeks so that we can get this medication initiated, and then you'll go home until you're ready to deliver or whatever the plan ends up being as you go through the pregnancy. So at 25 weeks, I packed a bag and I was so excited. I'll never forget. There was the nurse that came out to get me into the lobby once I checked in and everything. And I ran from the parking garage in to check in. I was so excited because I was like, I'm leaving this place with a baby. I'm so excited. I cannot wait. And they had decided at first they were going to initiate the medication and then release me. And Dr. Colombo's like, she's going to stay here. And they normally don't do that. They normally will just hook you up, watch you for a few days, and then let you go. But they didn't with me because he knew I was not going to go very far. So I stayed in the hospital, and I forget, what was his name? Harold was his name. He came out, and he saw all my bags. He goes, this ain't no motel. What are you doing, moving in? And I forget where he's from. He's not from America, but oh my God, his accent. He was just hilarious. And so I was like, nope, I'm having a baby here. And he's like, well, let's go do this thing. And I'm like, oh my gosh, I love him. So I went in. I was on 2 Ross. Is that where they take you? You don't know.
Yes, and I
Probably
feel like
2 and 4.
2 and 4. Or maybe 7's ringing a bell too.
Yep, I've been on 7.
But maybe that's because that's where our 6-minute walk is. It's on the 7th floor.
I think 7 is the floor that we go. Anyway, so they started the Remodulin, which for me was really, really scary because they kind of were like telling me it's sort of like a chemo type drug. Like it's got to be like they slap all kinds of like things on your wall. Like you can't use this arm for blood pressures. You can't, mix it with this med. You can't use this. You can't. I mean, it's like all these cans. And once they hook you up to it, it's very difficult to come off of it. So I was like, this is like serious. And I was always that patient was like, nope, I'll take oral pills. I am not doing IV medication. No way, Jose. It's going to ruin my life. I can't do. No. So that was the one difference is I can have a baby. Where do I sign? Like hook me up everywhere. I don't care because I get to have a baby. So I was like, cool. But it was really emotional for me. And I remember crying as soon as they were getting ready to start it because I was scared. Once I go on this, I'm not going to come off of it. But it's worth it because, again, I get a baby. So I was in there and they were doing ultrasounds weekly. And 28 weeks comes along and they do my ultrasound. And a team of doctors came in like almost, oh my gosh, maybe 30 minutes after the ultrasound. And they basically told me the baby's not getting enough oxygen. He hasn't grown since last week. We're going to have to deliver. And I was like, wait, hold on. He's 28 weeks. Like, what's going to happen? It's too early. We can't do this yet. And the one doctor looked at me and he said, it's safer for him to be out than it is to be in. We can care for him better out here than you are caring for him in. And I was like, that doesn't make any sense, but okay, whatever. And I knew that they had a top-notch NICU. Like, I knew all of that. So the next day, they prepped me and got me ready to go to the OR. And they had to deliver me under anesthesia just because, number one, he was breech. Number two, he was so light that if they had induced me, he wouldn't have dropped. And number three, they wouldn't put me through an actual vaginal delivery because of the work that it does, in your heart and stuff. So they wouldn't allow me to have vaginal delivery. But the reason they put me under was because there was a chance they would have to put me on ECMO. And for those of you that don't know what ECMO is, it's basically a machine pumps your heart and your blood like through your body.
That's what they put you on when you have like open heart surgery.
Yes. Yeah. So it's basically your blood is outside your body and it's like working for you and oxygenating your blood. That was worst case scenario at that point was that could possibly happen. If something went wrong, they wanted to have the most controlled area possible for me. So I went in and I had been journaling the whole time I had been in the hospital because it was just kind of one of those things like, I'm doing this. Like, we aren't supposed to do this and I'm doing this. Like, people have got to know, like, what's going on. And I remember the night before they were getting ready to take Camden, I wrote a letter to my husband. This is where my tissues are going to come in. I wrote a letter to my husband and I wrote a letter to Camden. And my letter to my husband basically said, please don't be upset with me. I died doing what I wanted and I died being happy. And I just basically told him I knew he was going to be a great father and I would be watching over them at all times. And the one to Camden basically was, I'm sorry I left you. But you have to know how much I loved you. I loved you so much. That's why I did this. I wanted you so bad that I was willing to risk my life to have you. And you have an amazing daddy, and he's going to take good care of you, and I'll be watching over you when you graduate, when you get married. I'll always be part of you. And so, and Bryce didn't know about those letters, obviously, because I didn't die, but he didn't know about those until just recently.
Oh, really?
I actually showed him, yeah. And obviously they never got them, so.
Yay.
Yay. So, needless to say, I went in, they did their operation, they did a C-section, everything went well. I came out, I was in recovery. I remember waking up. I remember people coming in to visit me. We were all celebrating. And the very first thing I did was I asked for a cell phone, and I called my family doctor. And I said, Dr. Rittenauer, it's Crystal. I just wanted to let you know I had Camden, and I didn't die. You were wrong. And he's like, you just had Camden? And I said, yep. And he's like, and you're calling me? I was like, yes.
Yeah.
So that was the part of me that had to prove somebody wrong. Like, that was that little piece coming out of me of, you're wrong, you don't know everything, you're not God type thing. And then I don't know how much time passed, but I remember seeing them bringing blood and fluids and like all kinds of stuff in. And I remember, obviously it was foggy because I was still coming out of anesthesia, but I remember Dr. Colombo coming in and doing a bedside ultrasound. And I remember telling my mom, I think, that my stomach felt weird. And the nurse was like, honey, you just had a baby. It's, it's probably normal. So I don't really know at what point they figured out what was going wrong other than my blood pressure probably dropping. He came in and he did a bedside ultrasound and found that I was bleeding internally. And so they were like, we're going to have to take you back to OR. And he looked at me. He said, this may be your uterus. We may have to take your uterus. And I was like, okay, no big deal. And like going in, I was like, oh, no big deal. They're going to fix it and I'm going to come out. Everything's going to be cool. They didn't fix it. I didn't come right out and everything was not cool. I ended up hemorrhaging really badly, and I know a lot of people have asked me if it was DIC, is that what it's called? Mm-hmm. It was not. They still really don't know what it was or what caused it. But I went back in the OR and they took my uterus because, again, that's what they thought was bleeding. They looked for, placenta, something that could have been left behind. They took out all of my organs and basically placed them on table, wherever they put them, looking for the source of blood from every organ. Well, it wasn't coming from an organ. It was just coming from everywhere. It was seeping blood from everywhere inside. And I remember, I wish Bryce was here because his story is so much better. Yeah. I remember Bryce telling me they came out and it was hours. He said he doesn't even know how long it was. It was hours that I was in there, and they finally came out and told him, we're doing all we can. We can't find the source of the bleed. We're doing all we can. Like, you may want to make some plans. And, Bryce's faith is like bigger than mountains. I can't even explain him. He's amazing. But they went back in and it came back out, and they had moved me finally to ICU, and they left my wound open. So I have a 13-inch incision down my belly. I'll save you guys the gore. But anyway, they left it open because they had me packed. Like, they were just packing it so that it would stay, so it would soak up the blood, I guess, basically. And they put me in a medically induced coma. And one of the doctors had come out a couple of days later, and he looked at Bryce and he said, we've done all we know how to do. We've called in everybody that we know to call. We've used everything that we know to use. If you believe in a God, start praying. And so I started out on 2 Ross, and I was up in 4 at this time. We had become really close with the nurses, almost like family. And they held my room for us because they were bound and determined knowing that I was coming back. And Bryce went up there, and he hit his knees, and he prayed to God, and he said, God, he said, you know, Crystal wanted this more than anything. Just have your way. He said, I want you to make her better. I want her to be able to meet her son. But it's your will. Do what you do. And I can picture him doing that every time. And so he waited and waited and waited. And this is where I'm going to get all biblical on you guys, and I'm sorry because I have to.
Don't be sorry.
My husband took a piece of paper and wrote Talitha Kumai on it, which means damsel arise. And that was what Jesus had said to the little girl who was dying, or who everybody thought was dead, in the Bible. And he put it in my little pocket of my gown. And he said that I didn't receive a bath. He didn't know what happened, but the letter was gone. And a couple days later, I started to wake up. And I started to get better, and just things just started to turn around out of nowhere. And I ended up with over 80 units of blood products.
That's a lot.
Bryce used to joke, and he's like, they had 3 blood drives while you were under, like, so I don't know if that was...
Because the average body hold is what?
8 liter? I don't remember. 6?
7.5 liters?
I don't know. Anyways, I lost all my blood.
I work in orthopedics.
I have somebody else's blood, like all of Columbus, running through my body.
Her blood has been replaced like multiple times.
It's not mine. But anyways, I had horrible nightmares when I was in the coma. I dreamed that my husband was having an affair with the nurses. Like, it was horrible. A lot of people were like, did you see God? I was like, nope, but I'm pretty sure I saw Satan, because it was awful.
Yeah. You were on the ventilator at this point.
Yeah, I was on the ventilator. And I know that Dr. Daniels had told Bryce that if they didn't get me off soon, that they may have to do a trach.
Yeah.
And I remember telling Bryce, if I would have woken up and I had a hole in my throat, somebody would have gotten punched, because I would have been so mad.
Yeah.
He's like, well, we would have had to do what we had to do to save your life. And I'm like, I'm pretty sure you already did that. Do not cut a hole in my throat. Not happening. So anyways, a lot of people will be like, when did you know that you had a baby? Like, when you woke up, did you realize? And I really can't answer it, because I don't know. I really don't know what I thought when I woke up, other than the fact I thought that Bryce had an affair. Like, I don't remember when the whole baby thing kind of came into play. I do remember the pain. I remember waking up, I think it was probably that first night, and I remember waking up and looking at my nurse, and I said, why didn't you guys just let me die? And she said, honey, when you see your baby, you'll know why we fought to save you. And it was almost a month before I actually got to see Camden. I remember when I woke up in initially, one of the NICU doctors came over to talk to me, and she had brought me a couple pictures of Camden. And I remember asking her if he cried. And she said, yeah, he did let out a little cry. It was tiny, but he did. And the cool thing of it is, that I'll say about Ohio State, is we basically were kind of famous there for a while, because like everybody was talking about us. But the NICU is in a completely different part of the hospital than I was in the heart center. And so they literally, Bryce was over at the NICU with my mom to show Camden to her when he got the phone call they were taking me back to surgery. So he like ran over to like say goodbye to me, before they took me back in. But the crazy part is when I had Camden and the NICU people took over, to take him to the NICU, they were running, basically, because they have this little 1 pound, 11 ounces, by the way, 1 pound, 11 ounces, taking him to the other part of the hospital. So they had guards, like, holding elevators to, like, get him over there quicker. It was amazing the lengths they went to for all of our safety. Mm-hmm. But it just was, everything went to hell in a handbasket, but not for the reasons that everybody predicted.
That's the way it seems to be going. Like, you expect it to be the pulmonary hypertension or whatever it is.
Yep.
And then that's fine, but then something else crazy happens.
Mm-hmm.
And I think in the future videos I'll kind of talk about my experiences with, you think you got everything under control, and then it's like, bam.
Yeah.
Hey, why don't we deal with this random weird thing that's going on?
Right.
And
you can't plan for anything with this disease, I feel like.
Yeah.
I feel like, so they planned on, like, my heart failing, my lungs, like, everything but me hemorrhaging. I mean, this was just, and to tell you, it's never happened to any other patients since me. It never happened before me, so it was just kind of luck of the draw. And one of the things that I will say, and maybe as a health provider, you might get where I'm coming from. You know how when you get pregnant, your blood volume, like, doubles?
Mm-hmm.
And that's, like, the scariest part is once you deliver your baby, you lose all that fluid, like, that balance kind of has to come into play, and that's what makes it so dangerous for us. I almost
shift in fluids.
Yeah, I almost feel like that was my body's way of protecting itself, if that makes any sense to you.
Like, you had too much?
I had, well, yeah, but, like, if I had lost all the blood right away, like, we would have had that fluid shift. But since I was, like, seeping blood, it was almost like my body's way of slowly ridding itself of it in a way that made it safe. Like, does that make sense?
Kind of.
Like, I
your
guess
body knew that there was too much here.
Yeah, but it can't get rid of it all
like
of a sudden.
Slowly trying to get everything at a steady state.
Yeah, I know that sounds dumb, but I guess that's kind of how they played it out in my mind.
I mean, when you have so much time to think about things like that, you come up with some crazy things.
So anyways, if you're still watching, because this is a super long story, it's so much, there's so many more details that go with it. I do want to say, if you are considering getting pregnant, please, 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 please talk to your doctor before. Don't go there pregnant and say, hey, what are you going to do with me now?
Yeah, there's a lot of prep work that goes into it.
Please don't ever, ever, ever do that, because it's not safe. And I have heard stories where patients have gone to their doctors